Hello and welcome to our Get to Know Your Chicken video.
Today we'll be going over the various systems of the chicken.
We will be going into detail about the external anatomy, musculature, digestive system, respiratory system, circulatory system, urogenital system, and the reproductive system.
We will first start with the external anatomy of the chicken. Here we have the ear and the earlobe. The earlobe is a modification of the skin, and its color corresponds to the color of their eggs. Next, we have the comb and wattle, which are also modifications of the epidermis. Their appearance differs among breeds and are significant for sexual display. Feathers are seen covering the body, protecting it from damage and providing insulation. The keratin-derived structures form patterns and tracts. Chickens molt their feathers in the fall, before winter, when the days get shorter and there is less light. When a hen molts, it loses its feathers in order, from head to tail. Their molt usually causes a halt in egg production. We removed several feathers from the underside of the wing so that the brachial vein would be visible. The brachial vein lies between the biceps brachialis and the triceps humerellus. This is the region where blood would be drawn from a chicken. Here we have the oral cavity. First you'll notice there are no teeth. The tongue of the chicken is triangular shaped and has minimal taste buds. The few taste buds it has are located on the caudal portion of the tongue. The uropygial or preen gland is located at the base of the tail. It's a bilobed sebaceous gland. It secretes oil, which the chicken preens and distributes over its body.
Now we're going to move on to the muscles of the chicken. The superficial pectoral is also known as the pectoralis major, and it is what makes up chicken breast. Also, it is the largest muscle of the bird and contributes to most of the force necessary for the downward movement of the wing. The origin is at the sternum, furcula, and sternal ribs. It inserts at the ventral surface of the humerus. The supracoracoideus is also known as the pectoralis minor. It lies deep to the pectoralis major and is responsible for the raising of the wing in the upstroke. It originates at the sternum, furcula, and sternal ribs. It inserts at the proximal dorsal surface of the humerus. This muscle is interesting in that it uses a natural pulley system. The tendon of the supracoracoideus passes along the medial surface of the coracoid bone and through an opening formed by the coracoid, scapula, and humerus. The tendon then inserts on the dorsal surface of the humerus. The sartorius is a long, thin band at the anterior border of the thigh. It flexes the hip and extends the knee. It originates at the lumbosacral area and inserts at the patellar ligament. The iliotibialis is also known as the gluteus maximus. It is a sheet-like muscle that covers most of the thigh. It originates at the pelvis and inserts at the proximal tibia and the patellar ligament. It flexes the hip and extends the knee and lower leg. The semitendinosus originates at the ilium and ischium and inserts on the caudal femur. It extends the thigh. The tibialis anterior originates at the anterior and distal femur and the proximal tibiotarsus. It inserts at the anterior surface of the tarsometatarsus. It also flexes the metatarsus forward. The gastrocnemius has three heads that originate from the distal femur and the proximal tibiotarsus, and it inserts at the tuberocalcini. It flexes the knee and extends the foot. The adductor longus originates at the ventral border of the ilium and pubis and inserts at the distal femur. It adducts and extends the thigh. The semimembranosus originates on the lateral surface of the ischium and inserts on the caudal surface of the tibiotarsus. It extends the thigh and flexes the knee. The ambiens originates on the ilium and pubis and inserts on the proximal tibiotarsus. It's a femoral flexor. Quadriceps femoris is observed from a medial view lying posterior to the sartorius. It originates at the ilium and inserts at the patellar ligament. It extends the thigh. The biceps brachii is a flexor of the wing running ventral to the humerus. The two heads originate near the glenoid fossa of the shoulder joint in the proximal end of the humerus. They insert at the proximal anterior surface of the radius. The triceps brachii flexes the shoulder and extends the forearm. The two heads originate from the scapula and the proximal humerus. They insert at the olecranon process of the proximal ulna. The deltoideus is a sheet-like muscle covering the dorsal shoulder originating at the proximal clavicle and inserting at the deltoid tuberosity of the proximal humerus. This muscle flexes the shoulder and rotates the wing outward. Note that it is not visible in this view.
We will now begin to discuss the digestive system. Here is the mouth of the chicken. Notice that chickens do not possess lips or teeth. The mouth holds food contents, which then travel down the throat to the esophagus. The beak is utilized for picking up, holding, tearing, and/or crushing food. The tongue, as previously mentioned, is also part of the digestive system. The esophagus is a muscular tube which carries food from the crop to the gizzard. It can be seen running perpendicularly and dorsally in comparison to the trachea. The crop is a sac-like structure utilized for temporary storage of food. The proventriculus can be defined as the glandular stomach in the chicken. As a true stomach would, it secretes hydrochloric acid, peptic enzymes, and mucus in order to aid in digestion of food. The gizzard is encountered next in the digestive system. The gizzard is a muscular structure with dense walls and an inner surface that is often compared to sandpaper. The contraction of the muscular walls aids in grinding, mixing, and breaking down food and other small substances such as stones into fine particles. The small intestine is composed of the duodenum, jejunum, and ileum, where the jejunum and ileum lie posterior to the duodenum. In situ, the mesentery holds the small intestine to the dorsal abdominal wall and also supports the mesenteric arteries, both inferior and superior, and veins in the tissue. The main function of the small intestine is to absorb nutrients from the broken down feed. The pancreas lies in the duodenal loop of the small intestine. The ducts themselves are hidden by tissue, and the bile ducts enter the duodenum near the pancreas. The two intestinal ceca act as the reservoirs for bacterial populations needed in the digestive system in order for the animal to digest cellulose. They are also necessary for water absorption. The large intestine's main function is the absorption of any water left behind by the previous processes of the digestive system. The liver is composed of 4 lobes and is best described as a gland that aids in detoxification and bile production. It is held into place by coronary ligaments and falciform ligaments, which place the liver on the ventral side of the body cavity. The gallbladder is the storage compartment in which the liver-made bile is stored. It is able to dispense bile into the duodenum so that it may aid in digestion and lipid absorption. Lastly, the cloaca is the region from which the fecal matter is expelled from the chicken's body.
At this point, we're going to move on to the circulatory system. The pericardial sac is the dual membrane fibrous covering of the heart. It contains pericardial fluid, which acts as a lubricant for normal heart movement. The heart in avian species is 4-chambered, and in chickens it beats 200 to 300 plus times per minute. The heart rate of smaller species can exceed 1,000 beats per minute. The 4 chambers of the heart are the right and left atrium, as well as the right and left ventricle. The right ventricle pumps blood to the lungs, which is known as pulmonary circulation, while the left ventricle, the more muscular of the two, pumps blood to the rest of the body, which is known as systemic circulation. In chickens, the aortic arc reflects to the right, unlike the typical left reflection common of mammals. Then there are brachiocephalic arteries that branch off and rise to the common carotid and subclavian arteries. The abdominal aorta is the largest aorta in the abdominal cavity, and it's essentially a continuation of the descending aorta. On the note of blood vessels, there is a hepatic portal vein which carries blood from the GI tract and the spleen to the liver.
We will now go over the respiratory system of the chicken. The opening into the airway from the mouth is called the glottis. The trachea is an airway lined with cartilage rings for stability. It possesses a branching point, or bifurcation, from which the 2 primary bronchi emerge. The syrinx is a cartilaginous structure located at the bifurcation of the trachea into the 2 primary bronchi. The syrinx allows birds to produce their characteristic sounds. The lungs of the bird emerge after the bifurcation of the bronchi and can be seen along the ribs of the breast area of the chicken. They are air-filled, and in birds, they have extensions off of the lungs called air sacs. The air sacs cannot be seen as they collapse after the dissection of the bird.
Now we'll move on to the reproductive system. A chicken's reproductive system allows a follicle developing in the ovary to become a mature egg that exits from the cloaca to be incubated during further development. The reproductive system of the chicken is different from a mammal's in that only one oviduct is fully developed. The ovary and oviduct are only present on the left side. Follicles are structures where female gametes, called oocytes, grow to maturation, and they start out as small and white, but as they develop, they become much larger and take on a yellow color. When the largest follicle is ready to ovulate, it ruptures at an area called the stigma, and the oocyte is ejected. The post-ovulatory follicle loses its structure and is no longer aiding this particular oocyte in its growth. In the chicken, this happens about once every day. The oocyte is then caught by the infundibulum, a cone-shaped portion of the oviduct that funnels the oocyte down the oviduct into the magnum. The magnum is thick and secretes proteins crucial to the development of the egg, such as albumin. It then travels to the isthmus, a thinner portion of the oviduct that creates the membrane of the developing egg. It then passes into the uterus, also known as the shell gland, which is where the outer shell gets formed. The junction between the shell gland and the vagina stores sperm and is where the egg passes through on its way to the cloaca, where it is then deposited outside the body for further incubation and development. In this specimen, there is a developing egg in the isthmus that is about 4 hours old. It is possible to tell how old the developing egg is because it spends a set amount of time in each section of the oviduct. It would have spent 15 minutes traveling through the infundibulum, 2 hours in the magnum, and between 1 to 2 hours in the isthmus, where it currently is. From here, it will spend 20 hours in the uterus before it is ready to exit the body. The male reproductive system is somewhat simpler. Spermatozoa are produced in the testes, where they then travel through the vas deferens. Before ejection, fluid is added from lymph glands instead of from seminal vesicles or the prostate, as in mammals.
We will now go over the urogenital system. The urogenital system serves to remove nitrogenous and metabolic waste from the body. This excretion of urates regulates the osmotic fluid balance of the body. Chickens do not have a bladder, and the urates are insoluble, therefore requiring large amounts of water to excrete from the body. Here we have the kidney. The kidneys are found in the dorsal cavity of the abdomen and the bony cavities of the pelvic region. The kidneys are divided into 3 lobules. Urine is carried from the kidneys to the cloaca through the ureters. The ureters are tubules that run alongside the abdominal aorta. They emerge between the most cranial and middle lobe of the kidneys.